Now, the Pantang Hospital is to provide quality health care to people in mental health crisis, but the facility is in dire need of attention, including maintenance and facelift. A visit by GBC News to the facility showed dilapidated infrastructure, inadequate critical staff, a bad road network, and encroachment by some residents.
The Pantang Hospital is the second largest among the 3 public psychiatric hospitals in the country. Currently, there are 40 operational departments and units in the hospital. The hospital has 9 wards, with each ward having about 50 beds. There are 2 male and female VIP wards. It has an occupational therapy department, a drug treatment and rehabilitation unit.
The current national approach to mental health treatment is one that is community-based. So as much as possible, we're treating people within their own communities. So that is how come you have the psychiatric units in all the districts. Because the best rehabilitation is for you to function within your community, not an artificial created place where you need to go and, okay. So don't take the person away from their routine for too long so that they lose it. So quickly get them back into their normal routine.
It receives many psychiatric patients from all over the country and few cases from neighboring countries such as Togo, Benin, Burkina Faso, Ivory Coast and Nigeria. Dr. Frank Benin is the director of the hospital.
All the challenges you see in mental health is money. It is because there is no sustained mechanism in place to make sure that mental health services are properly and adequately financed.
According to him, mental health is not given much needed attention.
We should be treated like Ghanaians, okay? Mental disorders should be treated like all others, like malaria, like hypertension, like pneumonia. Why should it be that if today, touch wood, I'm suffering from malaria and I go to the hospital, I should be able to receive help free on the National Health Insurance Scheme. But if tomorrow I suffer from depression, I would have to pay out of pocket. Why? There should be a clear-cut implementation policy. That is where we'll be able to sort of have a national coordinated approach to how we are tackling this thing. There are things that are being done to reduce these things, because if mental health is strongly associated with these things and you are treating these mental disorders and providing the necessary support, then obviously you want these things. But there is no coordinated approach to this particular phenomena.
The Pantang Hospital was originally planned by Dr. Kwame Nkrumah in the 1960s to be a Pan-African mental health village that will take care of people with mental health disorders in the West African sub-region. The vision of having a fully completed hospital was, however, curtailed following the overthrow of Dr. Kwame Nkrumah. In 1975, the hospital was commissioned and its partial state of completion by General I.K. Champon as a 500-bed capacity hospital.